Top 10 medications that could increase dementia risk, hidden dangers uncovered. Imagine popping a pill for a common ailment, be it allergies, anxiety, or sleep troubles, and unknowingly increasing your risk of dementia. Medications are generally intended to help us, but emerging research suggests that some widely used drugs might have hidden consequences for our cognitive health. In our modern world, millions rely on these drugs for relief, yet the long-term impact on brain function may not be widely appreciated. Today's discussion explores the top 10 medications that studies have flagged as potentially contributing to cognitive decline and dementia. If you or a loved one use these medications, you might find the information herein both eye-opening and essential for future health decisions. 1. Diphenhydramine, Benadryl. Diphenhydramine is one of the most common antihistamines available over the counter, used for allergy relief and as a sleep aid. It belongs to the anticholinergic class of drugs that work by blocking the neurotransmitter acetylcholine, a critical chemical for memory and learning processes. Although it provides quick relief from symptoms, its impact on brain chemistry, especially in older adults, raises serious concerns. The ease of access and widespread use of diphenhydramine contributes to its status as a hidden risk in many households. Scientific studies have noted a connection between regular diphenhydramine use and an increased risk of cognitive decline. In particular, research indicates that long-term consumption, even in standard doses, might lead to deterioration in brain function, ultimately predisposing users to dementia. The cumulative effect of these drugs is especially concerning as the brain ages. Researchers have emphasized that the risk amplifies with prolonged use and higher dosages, making chronic use a particular red flag. While occasional usage for a short-term allergy flare or a single restless night might not be harmful, reliance on diphenhydramine as a nightly sleep aid could initiate a cycle of dependency. The routine suppression of acetylcholine over time may contribute to gradual memory loss, meaning what starts as a benign solution could evolve into a significant risk. It is therefore important for patients to consider the balance between immediate relief and long-term cognitive health. In addition, the risk associated with diphenhydramine is compounded by its inclusion in many combination medications for colds and flu. This means users might accidentally consume higher doses than they intend, unbeknownst to them. Clear labeling and mindful usage are critical, especially in vulnerable populations such as the elderly. Health professionals urge patients to read labels carefully and explore non-anticholinergic alternatives when possible. Lastly, while diphenhydramine remains effective for managing allergic symptoms, its potential to contribute to dementia cannot be overlooked. Patients and caregivers should consider discussing with a healthcare provider the risks versus benefits of long-term use. There are now many alternative treatments available that reduce the anticholinergic burden, offering safer options for those in need of regular allergy or sleep support. 2. Benzodiazepines, e.g., Valium, Xanax, Ativan. Benzodiazepines are a class of medications widely prescribed for anxiety, panic disorders, and insomnia. They work by enhancing the neurotransmitter GABA, which calms the brain and helps reduce anxiety quickly. Their fast-acting nature has made them a go-to remedy for acute episodes of anxiety, but this rapid relief often comes with the cost of potential long-term effects. The soothing effects that bring temporary relief can, over time, become a double-edged sword for brain health. Multiple studies have flagged a correlation between prolonged benzodiazepine use and increased risks of memory impairment and cognitive decline. In particular, research shows that taking these drugs continuously for several months may start to impair memory and learning capabilities. The mechanism behind this involves not just temporary sedation, but sustained alterations in neurotransmitter balance that might compromise neural plasticity, the brain's natural ability to adapt and learn. Older adults are especially vulnerable to the adverse effects of benzodiazepines. Their developing sensitivity to drugs combined with existing age-related cognitive decline can lead to heightened risks such as confusion, falls, and overall decreased mental performance. Medical professionals have voiced concerns that the routine prescription of these medications to seniors might inadvertently accelerate the onset of dementia-related symptoms, even in those who initially sought help only for anxiety or sleep issues. The transition off benzodiazepines, however, is not straightforward. Sudden discontinuation can produce withdrawal symptoms that further impair cognition. Consequently, any plan to reduce or stop using these drugs must be closely managed by healthcare providers, who might recommend gradual tapering and the incorporation of alternative therapies such as cognitive behavioral therapy, CBT, or lifestyle adjustments to handle anxiety and insomnia. In summary, while benzodiazepines serve an important role in managing acute anxiety, their long-term implications on brain health call for caution. Patients who rely on these medications should be informed about the potential risks and work with their doctors to balance short-term benefits with long-term safety. Understanding these trade-offs is key to preventing unwanted cognitive side effects down the road. 3. Other anticholinergics, e.g., oxybutynin, amitriptyline, scopolamine. Beyond diphenhydramine, numerous other anticholinergic medications are routinely prescribed for a variety of conditions including overactive bladder, depression, and motion sickness. Medications like oxybutynin, amitriptyline, and scopolamine similarly block acetylcholine, a vital neurotransmitter for memory formation and cognitive functioning. Their therapeutic benefits make them indispensable for many patients, yet the anticholinergic effect is a double-edged sword that can slowly erode cognitive reserve over time. Research consistently links prolonged use of potent anticholinergics with a higher risk of developing dementia. Data suggest that the greater the cumulative exposure to these drugs, the higher the chance of experiencing measurable declines in brain function. The underlying premise is that the consistent suppression of acetylcholine interferes with neural pathways, leading to memory deficits and other cognitive impairments that resemble early dementia symptoms. The conversation around these medications becomes especially important in individuals over 60, whose cognitive resilience is naturally diminished with age. Even modest doses in older adults can have a pronounced impact on memory and mental acuity, suggesting that what might be considered a safe dose for younger individuals may not be appropriate for seniors. Clinicians are encouraged to review the anticholinergic load of patients, especially those with multiple prescriptions, to reduce potential risks. Modern healthcare practices now emphasize the importance of minimizing anticholinergic exposure. Physicians are turning to alternative treatments with lower cognitive risk profiles and regularly reevaluating medication lists for older patients. This proactive approach not only improves overall cognitive health but also enhances quality of life by reducing the likelihood of abrupt cognitive decline. For those already on anticholinergic medications, heightened awareness is crucial. Regular consultations with healthcare providers about the risks, benefits, and possible alternatives can make a significant difference. Being proactive in seeking alternatives or dosage adjustments could be the key to preserving cognitive function over the long term. 4. Antipsychotics, e.g., Risperdal, Seroquel, Zyprexa. Antipsychotic medications are primarily used for severe psychiatric conditions such as schizophrenia and bipolar disorder. They play a critical role in stabilizing moods and reducing psychotic symptoms. However, these powerful drugs also influence the brain in significant ways that can have long-term consequences, particularly in elderly patients. Their sedative properties might seem beneficial for controlling agitation, but they can also pave the way for increased cognitive risks. Recent research has drawn attention to the possibility that antipsychotics might contribute to a faster rate of brain atrophy in some patients. In studies focusing on dementia patients, the use of these medications has been linked to worsening cognitive decline and, in some cases, an increased risk of death. The paradox of using drugs designed to manage behavioral issues in dementia, only to potentially exacerbate cognitive impairment, has led to a growing debate in the medical community. Though they offer short-term stabilization, the chronic use of antipsychotics can lead to serious side effects. Many patients experience a deepening of memory loss and difficulty in decision-making over time. The mechanism involves alterations in brain receptors and neurotransmitters beyond those intended by their therapeutic use. Thus, while they may control some disturbing behaviors, they also bear the risk of diminishing the very cognitive functions clinicians hope to preserve. For many families, the decision to continue antipsychotic treatment in elderly patients is fraught with difficult choices. The balance between managing severe behavioral symptoms and safeguarding cognitive function becomes a crucial discussion in every care plan. Healthcare professionals now routinely recommend exploring non-pharmacological approaches as first-line treatments to mitigate behavioral issues in dementia patients whenever possible. Ultimately, while antipsychotics are indispensable for certain conditions, their use in the context of dementia requires cautious evaluation. Regular monitoring, dose adjustments, and the adoption of alternative therapies whenever possible are key strategies to minimize cognitive risks. Making informed decisions together with healthcare providers can help optimize patient outcomes and quality of life. 5. Proton pump inhibitors. Proton pump inhibitors, PPIs, such as Nexium, Prilosec, and Prevacid are among the most commonly prescribed medications for acid reflux and gastroesophageal reflux disease, GERD. By reducing the production of stomach acid, these drugs provide relief from heartburn and other related symptoms. However, their long-term use has been associated with an emerging set of risks, notably a connection with vitamin B12 deficiency, a key nutrient for maintaining cognitive health. The reduction in stomach acid production is a double-edged sword. While it alleviates discomfort from acid reflux, it also disrupts the absorption of essential vitamins and minerals. Vitamin B12, in particular, plays a pivotal role in neurological function, and its deficiency can lead to memory problems and even irreversible damage if left untreated. This link between PPIs and cognitive decline has raised concern among healthcare professionals regarding chronic usage beyond the recommended period. The risk is especially notable among older adults, who naturally absorb vitamin B12 less efficiently. Long-term PPI users in this demographic are at heightened risk not only for B12 deficiency but also for its subsequent cognitive consequences. Many observational studies have indicated that those on PPIs for over a year may experience an increased rate of cognitive impairment compared to non-users, prompting calls for more cautious prescribing practices. Given these concerns, doctors now emphasize the importance of periodically reviewing the necessity of continuing PPI therapy. Many healthcare providers advise that patients explore lifestyle modifications, such as dietary changes, weight management, and the avoidance of trigger foods, to help manage GERD symptoms. Such steps can potentially reduce the duration of dependency on these medications while preserving cognitive health over time. In summary, while PPIs remain effective for treating gastroesophageal disorders, it is essential to balance their benefits against possible long-term cognitive risks. Patients using PPIs should have their vitamin B12 levels monitored regularly and discuss alternative management strategies with their healthcare provider. This proactive approach helps ensure that the relief from acid reflux does not come at the expense of long-term brain health. 6. Statins, e.g., Lipitor, Crestor, Zocor. Statins are widely prescribed for managing cholesterol levels and reducing the risk of cardiovascular events like heart attacks and strokes. By blocking an enzyme involved in cholesterol production, These drugs have become a mainstay in preventive medicine. However, for some patients, lowering cholesterol too aggressively might have unintended consequences. There is ongoing debate about whether statins might affect cognitive function in certain cases. Some users of statins report experiencing memory lapses and bouts of confusion, sparking investigations into the potential cognitive side effects of these otherwise life-saving drugs. One theory suggests that cholesterol is vital for maintaining healthy brain cell membranes. Without enough, communication between neurons might be compromised. Although clinical studies have produced mixed results, a subset of patients clearly notes a decline in mental sharpness after beginning statin therapy. On the other hand, it's important to recognize that cholesterol itself plays a key role in many bodily functions, including brain health. The delicate balance involves ensuring that cholesterol levels are low enough to prevent cardiovascular disease while still maintaining sufficient amounts to support cognitive functions. For many patients, the cardiovascular benefits of statins far outweigh the potential risk of cognitive side effects, making the decision highly individual. Moreover, researchers are still trying to determine who might be most at risk for these side effects. Age, genetic predisposition, and the presence of other conditions may all contribute to whether a patient experiences cognitive difficulties on statins. Some patients report improvement in brain function when their dosage is adjusted or when a different statin is prescribed, indicating that managing this delicate balance is possible with careful medical supervision. Ultimately, the conversation about statins and cognition underscores the importance of personalized medicine. Patients who notice memory issues after starting on a statin should consult their doctor promptly. A comprehensive review might result in dosage adjustments or a switch to another lipid-lowering therapy that preserves both cardiovascular and cognitive health. 7. Antidepressants, e.g., amitriptyline, paroxetine. Antidepressants, particularly older medications such as tricyclic antidepressants, like amitriptyline, and certain selective serotonin reuptake inhibitors, such as paroxetine, have been known to possess notable anticholinergic properties. These drugs effectively treat depression and certain anxiety disorders, but their influence on acetylcholine can have a deleterious effect on memory. While newer antidepressants have been developed to minimize these side effects, many patients still rely on older options due to their efficacy. Research has shown that the anticholinergic burden from these medications can contribute to cognitive impairment over time. Patients on long-term therapy may experience side effects such as diminished memory, slowed thinking, and a general decline in cognitive function. This risk is compounded when these antidepressants are taken in conjunction with other medications that also affect brain chemistry, putting some individuals at higher risk of developing dementia-related symptoms. It is also worth noting that depression itself can sometimes mimic or mask early dementia symptoms, making the evaluation of cognitive decline challenging for clinicians. As a result, it becomes critical to consider the role that antidepressants might be playing in the overall clinical picture. Distinguishing whether cognitive deficits are due to the underlying disorder or a side effect of the medication requires careful evaluation by healthcare professionals. In clinical practice, the trend is shifting towards utilizing newer classes of antidepressants that exhibit fewer anticholinergic effects. By switching to these medications, patients might gain relief from depressive symptoms while potentially mitigating the risk of cognitive decline. Physicians often recommend that patients who experience troubling cognitive side effects consider alternative agents or adjunct therapies to address both mood and cognitive concerns. For individuals taking anticholinergic antidepressants, regular cognitive assessments and open dialogue with healthcare providers are essential. Monitoring changes in memory and mental acuity can help catch adverse effects early on, paving the way for timely intervention. It is a reminder that as we treat our mental health, preserving our cognitive well-being must remain a parallel priority. 8. Anticonvulsants, e.g., phenytoin, carbamazepine. Anticonvulsants are primarily used to manage epilepsy, but they are also employed to treat neuropathic pain and mood disorders. These drugs work by modulating neuronal excitability, effectively reducing seizures and stabilizing mood. Despite their therapeutic benefits, several anticonvulsants have been associated with cognitive side effects, including slowed thinking and impaired memory. Their impact on the central nervous system makes it essential to weigh benefits against potential risks in long-term use. Research has found that the cognitive effects of anticonvulsants can be particularly pronounced in older adults. With a slower metabolism and an increased sensitivity to central nervous system depressants, older patients may experience more significant memory deficits and slower reaction times. Even though these medications are crucial for seizure control, their potential to contribute to cognitive decline should not be underestimated. Long-term use of anticonvulsants has been linked to what some researchers describe as brain fog, a period of sluggish mental processing and diminished concentration. While not every patient on these medications experiences substantial cognitive decline, those who do may find that their quality of life is adversely affected. The cognitive side effects often develop gradually, making early detection and dosage adjustments crucial. Healthcare providers now advocate for regular monitoring of cognitive function in patients prescribed anticonvulsants. Such vigilance allows for timely intervention should memory impairments or other cognitive issues arise. The aim is to maintain seizure control while minimizing adverse effects on brain function, a balance that must be managed with ongoing clinical oversight. In summary, while anticonvulsants are indispensable for managing conditions like epilepsy and certain pain disorders, clinicians and patients should be aware of their potential cognitive costs. An individualized treatment plan, combined with regular cognitive evaluations, can help mitigate these risks while preserving the benefits of seizure or pain control. It is essential for patients to maintain open communication with their care providers to adjust treatment strategies as needed. 9. Opioids, e.g., oxycodone, morphine, hydrocodone. Opioids are among the most potent pain relievers available, often prescribed for severe or chronic pain management. Their ability to provide powerful relief is matched by a host of potential side effects, which extend beyond the risk of dependency. Opioids depress the central nervous system, slowing down many cognitive processes and sometimes leading to confusion and memory lapses. For patients with prolonged usage, the impact on brain function may become significant over time. Chronic opioid use has been linked to a phenomenon commonly referred to as opioid-induced brain fog. Users have reported difficulties with concentration, memory, and even decision-making. These cognitive changes are thought to result from the drug's effects on the neural circuits that govern alertness and mental clarity. While the immediate relief from pain is undeniable, the cumulative impact on brain health warrants a careful reassessment of long-term opioid therapy. Elderly patients are particularly susceptible to the cognitive consequences of opioid therapy. In these individuals, the natural aging process combined with drug-induced suppression of brain activity can lead to profound impairments in memory and cognitive function. The risk of falls, accidents, and even structural changes in brain tissue increases with chronic opioid use. Consequently, managing pain in older adults often necessitates a cautious approach that minimizes opioid exposure while exploring alternative pain relief strategies. For these reasons, medical experts are advocating for multimodal pain management strategies that reduce reliance on opioids. Integrating non-opioid medications, physical therapy, behavioral therapies, and other interventions can often provide effective pain relief without the same degree of cognitive risk. Transitioning to such approaches may safeguard not only overall health but also cognitive function over the long haul. In conclusion, while opioids play a critical role in managing acute and chronic pain, Their impact on cognitive function cannot be overlooked. Patients using these medications should be aware of the potential for cognitive side effects and work closely with their healthcare providers to regularly review and adjust their pain management regimens. The ultimate goal is to alleviate pain without sacrificing brain health. 10. Corticosteroids, e.g., prednisone, dexamethasone. Corticosteroids, such as prednisone and dexamethasone, are powerful anti-inflammatory agents used to treat conditions ranging from autoimmune disorders to severe allergies. Their effectiveness in reducing inflammation and suppressing immune responses has saved countless lives. However, these medications also influence brain chemistry, and when used at high doses or over long periods, they can lead to cognitive side effects. Patients using corticosteroids should be aware that while they address one part of the health puzzle, they may pose risks to brain function. One of the concerning cognitive side effects of corticosteroids is the development of memory problems, or what is often described as brain fog. High doses or prolonged treatment regimens have been linked to difficulties with concentration, confusion, and even mood disturbances such as irritability and depression. Research indicates that these effects may be due to corticosteroids' influence on the hippocampus, the brain region most closely associated with memory and learning. Such changes are especially worrisome in older patients already at risk for cognitive decline. The potential for cognitive impairment becomes even more significant when corticosteroids are used in combination with other drugs that affect the central nervous system. Patients with complex medical conditions who require multiple medications may experience compounded effects on brain function. This cumulative burden can exacerbate memory problems, making it more challenging to maintain a clear and focused mind. Frequent monitoring and careful management of dosages are essential to prevent these effects from worsening. Clinicians emphasize that while corticosteroids are often indispensable in acute medical situations, their long-term use should be periodically reevaluated. Tapering strategies and the use of the lowest effective dose can help minimize cognitive risks. In some cases, doctors might suggest alternative treatments or adjunct therapies that allow for a reduction in steroid dosage without compromising the treatment of the underlying condition. Such strategies are aimed at balancing therapeutic benefits with the need to preserve cognitive function. Ultimately, the decision to use corticosteroids must take into account the potential impact on long-term brain health. Patients are encouraged to remain vigilant for any signs of cognitive decline and to discuss these concerns with their healthcare providers. An informed approach, regular cognitive assessments, and a willingness to adjust therapy can help ensure that patients derive the benefits of corticosteroids while minimizing any negative effects on their memory and overall brain function. Medications save lives every day, but as science reveals, some common treatments may also carry hidden risks for our cognitive well-being. By understanding which drugs may contribute to dementia, you are empowered to have informed discussions with your healthcare providers about the safest long-term strategies. Do not hesitate to reassess your medication list and explore alternative treatments that can safeguard your brain health. If you found this video informative, please like, subscribe, and share it with friends and family. Spread the word and help protect the minds of those you care about. Stay informed, stay healthy, and keep your brain sharp.